So I have an MAR here for a Gwen Winthrop for February 10th, or she was born February 10th, 1942, and she has no known allergies. We're wanting to give her a subcutaneous regular insulin shot, and it's wanting to be at 7:30, which is in a few minutes. So I'm gonna go ahead and ask the faculty what her blood glucose level is so that I know the insulin dose. And what's the blood glucose level?
It is 155.
155, perfect. So according to the sliding scale insulin, we're going to give her 4 units today. Okay, I'm gonna go ahead and gather my equipment after I perform hand hygiene. Okay, so this is gonna be my first check of the right medication. So I'm gonna confirm that this is a regular insulin and that it has enough in here. So it's almost full and we just want 4 units. I'm also gonna check the expiration date, which is not till 2024. And since this is already an open cap, I'm also gonna check when it was originally opened and if it's within that date range. Great, so I'm gonna grab the rest of my equipment. So here I have some alcohol swabs. Since I did say that the cap is already removed, we're gonna wanna clean the top before we do any sort of injections. I also have my insulin needle right here, or insulin syringe, sorry. And then this is gonna be my second check. So I'm going to check that this is regular insulin, and again, the dates that are necessary. Great. I'm gonna go ahead and perform hand hygiene because you can't always be too safe. And I'm going to then use an alcohol pad to clean the injection site of the vial. I'm then going to open up my syringe and being careful to only grab the syringe. I'm going to use 2 OKs to open up to reveal the needle. I'm going to save the cap for later. And next I want to get some air to insert into the vial. And I'm going to move the safety mechanism so that I can see the numbers on the side accurately. So they asked for 4 units for the blood glucose level that we have. So I'm going to get 4 units of air. Perfect. Okay. I'm then going to go straight into the insulin, keeping this steady on the table. And I'm going to inject the air. I'm going to immediately invert it and get 4 units out, making sure to keep the needle straight. I'm going to take the needle out and immediately recap using the one-handed scoop method. I'm going to dispose of all of this. Okay. So now I'm going to be meeting the patient with all of my materials. Good evening, Miss Winthrop. My name is Megan Davies. I'm going to be your student nurse for the day. Can I go ahead and confirm your name and date of birth? Gwen Winthrop, February 10th, 1942. All right, do we have any known allergies? No? Perfect. Okay, so it says here that we're going to want to give you a subcutaneous insulin shot today. And I'm going to go ahead, since I've now verified the right patient, I'm going to verify that for the 3rd time that we have the right medication. Okay, regular insulin. And the right dates. Perfect. Also going to verify that we have the right dose. 4 cc's. Perfect. And for the right route, we're going to give this subcutaneously into the stomach since it is a more fattier area. For the sake of this video, we obviously don't have an umbilicus, so we are going to use this stress ball, but if we did, we would find the umbilicus and we would go an inch around, find a fatty part, pinch it, and then do the injection. I'm also going to do right documentation towards the end after I've already given the medication. And I'm also going to double check that this is the right time. Great. So I'm going to go ahead and perform some hand hygiene. And I'm going to apply some gloves. Okay, so I'm going to find the site that I want to do the injection at, and I'm going to clean the area with an alcohol pad. I'm going to start at where I want, and I'm going to work my way outwards to clean the area. And I'm going to leave the corner of the pad where I want the injection site so that while I get my syringe, I'll know exactly where it is. Okay, I'm going to then grab my syringe, do the double OK, pull it open. For the sake of this video, I am going to save this cap. I'm going to find the site that I had, taking great care to only touch the syringe. I'm going to move the alcohol pad out of the way, pinch the skin, and because this is a normal patient with normal amounts of fat, I'm going to do a 45-degree angle. If this were a bigger patient, I would want to do a 90-degree angle. So I'm going to pinch the skin, and in 3, 2, 1, I'm going to insert. Then I'm going to slowly push the insulin in. I'm going to hold it there for about 6 to 10 seconds, just so to make sure that the medicine stays its place. Okay, I'm then going to pull straight out. And I would then activate the safety mechanism, but for the sake of this video and reusing this, I'm going to do the 1 scoop method. Reseal, and then throw in the sharps container. And then I'm going to get an alcohol or a gauze, and I'm going to apply pressure here until there's no more bleeding, or the patient could go ahead and hold it if they wanted to. Okay, I would then make sure to do the right documentation that I injected into the patient, 4 units of regular insulin at 7:30. I would then remove my gloves, and I'd ask the patient, are we feeling any pain at all? No? Okay. What about the position of the bed? Does this seem okay? Great. I'm going to go ahead and lower it back down. And I see no pumps or anything like that. Your personal belongings. I'm going to go ahead and move your call bell right back here. Great. And do you need to use the restroom or anything like that? No? Awesome. I'm going to go ahead and clean up my area. And perform hand hygiene before I leave. Can I get you anything else? No? Great. Thank you so much. So I'm going to be demonstrating how to give intramuscular injections as well as a Z-track. I'm going to start with the intramuscular injection, and I'm going to start with the deltoid muscle. So for the purpose of this video, we don't have an actual human, but I'm going to verbalize exactly the landmarks that I'm going to use. So I would find the acromion process, which would be around here, around the shoulder. And I'm going to use 3 fingers from the acromion process down, going to find a V right here, and I'm going to be injecting right here. So I would clean the area with an alcohol swab and then do a 90-degree angle, do the injection, and hold there for about 10 seconds. I would obviously have my fingers removed at this point in time, but I would leave it there for about 10 seconds to make sure that the medicine stays within. Okay, for the next one, we have our ventrogluteal. It's kind of hard to see here, but like I said, I'm going to verbalize it. So you're going to want to find the greater trochanter, and you're going to want to put your palm on it. Your top fingers are going to sit on top of the iliac, and then your thumb pointing towards the umbilicus is going to find the interior iliac spine. Your index finger and your middle finger are going to make a V with your pointer finger pointing towards the umbilicus as well. And you're going to find a meaty area so that you don't hit bone. And just like we did in the last one, we are going to clean the area with an alcohol swab, do a 90-degree angle, and hold for 10 seconds. Next, I'm going to kind of demonstrate the Z-track method. So if this were to be a real patient, we would perform just like I demonstrated with the chromium process, 3 fingers and a V. So we'd want in this area. We would clean the area, but with our gloved hand, we would want to pull down the skin to make sure that it was taut, and then do a 90-degree angle injection. And then as you pull out, you're gonna wanna release the skin in order for the skin to close the site by itself. Sometimes there might still be some bleeding, so you could use some gauze as you would for all of the other sites. Okay.